Welcome, everyone. I'm Lisa Brown, Professor of Psychology at Palo Alto University. It is a pleasure to welcome you to our webinar series, At the Forefront of Mental Health. Palo Alto University is dedicated to addressing pressing and emerging mental health issues through research and training in the fields of psychology and counseling. Today, I'm going to address an important topic: older adults and depression. As clinical psychologist, I know that getting a family member or a close friend to seek and use mental health can be a challenging task. The truth is, according to the Centers for Disease Control and Prevention, depression affects more than 7 million of the 35 million Americans aged 65 years or older. Today, I'm going to share with you some information on how to detect signs of depression and some ideas for you to consider about how to get mental health support. So today's talk is depression, or is it the blues? So a few things for you to think about is considering, that sometimes people use language to describe how they're feeling. When we talk about depression, one of the first things when someone says, "Oh, I'm feeling so depressed," is to ask them how that feels for them. How do they define depression? By that, I mean that if I say I'm feeling really depressed and you say that you're feeling really depressed, it might be two very different lived experiences. So it's really important to check in to find out how that person's feeling and how they're defining their experience. We're also going to talk a little bit about why late life depression can be so difficult to recognize. There's a lot of conditions that kind of mimic it, and we'll get into more details about that in a few minutes. I'm going to talk briefly about some treatment options, not only things that clinicians can do, but you as a loved one or as a family member or as a concerned friend might be able to do to help the person better contend with and better deal with their depressive state. And then the last part of it, of course, is getting help. And that can be a really difficult thing to do. It can be difficult to find somebody who's got the ability to provide the services and care that's necessary to help that person feel a little bit better about where they are at this point in their life. So the first thing I want to throw out there is most people think that it's normal to be depressed when you're old, that if you're having health issues, if you're not feeling well, if things are not going right, that it's not unnormal to feel depressed. So I'm going to give you some facts about depression in older adults just to make sure that you have some foundational knowledge and know where I'm coming from. When you consider that 10 to 20% of older adults, they suffer from some type of mental health disorder, and that depression is a major predictor of suicide in older adults. Now, not everybody who's depressed is going to be suicidal, but a good number of people who are suicidal are depressed. So if somebody's depressed, you definitely want to try to get them help, to try to take steps to make them safe and keep them protected, because they are at greater risk for death by suicide. And then finally, when you think that, people who are 65 and older, they only make up 13% of our total population, but yet 18% of all deaths by suicide in 2000 were people 65 and older. So clearly there's a larger proportion of people in that age group than in other age groups who are actually deciding to take their lives. And it's a very serious public health issue. So what is depression? So what it is feeling down for 2 weeks or longer. So you're really feeling down on the dumps. You don't have energy. You don't feel good about yourself. There's a sense of feeling maybe empty, hopeless. You're not looking forward to the future. You feel apathetic, that everything is effortful, that things don't interest you anymore. They don't give you a sense of pleasure. And that maybe you have thoughts that your life would be better off ended, that going on and trying to get ahead is just way more than you can endure. What it's not is grieving or mourning a loved one. And that can be grieving or mourning a person or a pet. If somebody has a dog or a cat, Those relationships, many people call them companion animals because they're so meaningful to us. It can be grieving or mourning a change of life, where you're living one moment in your own home, and the next moment you're moving to an assisted living facility or a nursing home. And so grieving what used to be in terms of your lifestyle. It can be a sign of weakness or a lack of character, and that's not true. That it has nothing to do with people who don't have a strong constitution or some kind of flaw in your personality. It's just feeling depressed, and it's not a passing or a fleeting down mood. And by that I mean everybody has mood fluctuations throughout the day. Here you can see what looks like a road, and there's a red line on that road. And so if you think about the beginning of the road on the left side of the screen as the start of your day, and you can see where I get up in the morning and I have a cup of coffee and I look outside and I see the birds singing and playing around in the bird feeder, and my mood starts to lift. And so the red line starts to go up. And then I get my mail and I see that I have some bills that I need to pay in my mail. And so you can see where my mood starts to go down, and it dips down a little bit. And then I get a call from my friend who says, do you want to go out and meet me for lunch? And I say, oh, that sounds really great. That sounds very pleasant. And then again, my mood starts to go up. And then I'm out for lunch and I'm having a great time with her. And then she tells me that she's decided that she's going to be moving and has made plans to sell her home and move to another part of the country. And then my mood goes down and I'm feeling really badly that my really good friend is going to be moving someplace else. And then my mood goes up again because I think, okay, well, it gives me another place to visit. It gives me someone else that I can go and spend time with and have some new experiences. So you can see the ups and downs of my mood throughout the course of the day. So some of the factors that can end up leading to people feeling really depressed is retirement. Retirement is a major life transition. And for people whose identity has been largely defined by their career, their job, where they say, I am a CEO, or I am the chief librarian, or I am a professional dog walker. And then all of a sudden they lose that ability. That is something where having to adjust to that loss of identity from retirement can really be problematic for some people. It can be really difficult for them. Illness, that people who start to have medical issues, they need to reconsider about their health and about how they're feeling. And that might be really worrisome and troublesome for anybody at any age. But as you start to get older and you start to take stock of your health, and maybe you lose some of your functionality, that can contribute to depression. We do know that in families that depression can run in families, that there can be some sort of a transfer genetically. It's not for sure that this happens to everybody. If you have a depressed parent, it's not a foregone conclusion that you too or your children will have depression, but it's something where being really mindful about family history can really provide some context for what you're experiencing now in the present. We know some medications have side effects. If you've ever listened to any of the pharmaceutical advertisements on TV, you hear this whole litany of all these side effects. And medication can cause depression. It can cause anxiety. It can make people feel very uncomfortable. It can, loss of independence. If you no longer are able to get out and about and to function autonomously, that loss of independence can really, again, catch people and really make people feel that they don't have a lot to live for and feel very depressed, and that it's not worthwhile giving it a go. Loss of a social role as a parent, as a wife or a husband, that people sometimes talk about the empty nest syndrome, when although their kids go off to school and there's suddenly nobody at home anymore. And so again, part of who they are in the world has been redefined. And I think people, as they transition from one role to the other, it takes a while to sort of acclimate. And this is where, talking to others and seeing how others have done things, it can really make a big difference to find people who can sort of shepherd you through that process, through some of those transitions. And then last but not least are financial problems. Trying to find enough money to cover your rent, to cover medications, to pay for food, to help family members who may have their own financial issues. All of these things can lead to depression and anxiety and concerns that people have. And so there's a lot of factors that people have legitimate reason to feel depressed about, but it doesn't mean that they should be suffering with their depression alone. It doesn't mean that they should just suck it up and deal with it, that there are things that can be done and there's ways that people can be helped. I do want to take a few seconds to briefly talk about grief. I have lost loved ones, as I'm sure many of you have as well. And it is a normal response to a really significant loss. I mentioned before that people can feel grief about animals losing you. Here I've got a little picture where somebody is laying down some flowers for a headstone for their dog. And people in relationship with either animals or people or place can really feel a deep sense of keen sense of loss and grief. And that they'll mourn, and this outward expression of crying, of feeling sad, of just trying to shake it off, that this is a way of sort of processing, kind of digesting that experience and coming to terms with it, and learning how to cope and learning how to continue living despite having this really large loss in your life. I think that a crippling loss where one's not able to get over it and start living their life again in a way that the person or the companion animal would want that person to carry on, that's when you need to intervene. And so, usually it's 6 months after the death of a loved one or a major transition that you would want to seek help. But in the interim, you would need and benefit from social support, from people who come over and, we think about people bringing over casseroles or food, but a lot of times people will show up in the immediate aftermath of a big loss like that. And then they kind of get busy with their lives and they don't stop by as often or check in as often. But it's really months 4, 5, and 6 that are really important when the initial supporters sort of fall by the wayside because they're just busy. That's, stepping in to help somebody that in your social circle might be struggling with grief, and really trying to help support them and listening to their stories and find a way to memorialize the person or the animal that has died. So some signs of depression for you to think about is if you feel sad or empty, if you have feelings of guilt or worthlessness, that I don't bring any value to this life, I don't have any purpose. If you feel very, very tired, restlessness or irritableness is also a sign that if you've seen the movie Grumpy Old Men, there's the Merck Medical Manual describes older adult men as more likely to show signs of being irritable and grumpy, where women who are older and have lost a loved one or have signs of depression, they're more likely to cry and to show depression in ways that we traditionally think of people showing depression, sadness, tears, just really being distressed. But men are more likely to be irritable and grumpy. I don't need your help. If I want your help, I'll ask you for it. Go away, leave me alone. I'm just fine. And anyone that's thinking about ending their own life, those are all signs that you may have depression. And if this has been going on for 2 weeks or longer, that, talking to somebody and sharing how you're feeling is one of the first big steps in getting help. Sleeping more or less than usual, so disrupted sleep patterns are another sign. Eating more or less than usual. Sometimes people will think about people who stop eating as being depressed, But we see the opposite as well. We see people who are just eating a lot of food and eating a lot of carbohydrates or junk food because they just don't care enough, but they just are consuming to try to fill that gap inside of them. If you have trouble concentrating and remembering, and again, this is without having other types of memory problems or cognition problems. It's also not a side effect of medication that's causing your trouble concentrating and remembering, but it's a sign if you're not on meds or having other types of medical issues that you might be depressed, and then having pains that won't go away. Now, again, with all of these things, you want to rule out any kind of medical problem that could better account for these symptoms. That's most important thing is, if you're feeling badly like this, is making an appointment with your physician and going in and talking about the areas that you're having problems with and making sure that the doctor does a good workup and has an idea if there's not a medical problem that could better account for the problem that you're currently experiencing. And if the doctor gives you the green light and says, you're healthy, there's nothing physically wrong with you, then we want to go on and we want to take a look to see about depression. And so you can see by that list that I just gave you that there are probably some challenges in terms of recognizing who's got late life depression. That there's things where you think, wow, I feel tired, or I have problems sleeping sometimes, or sometimes I eat like the full bag of chips, and you can relate to some of the things that I just shared with you, but there's a difference. And so some of the things, these next two slides are going to basically provide you with some ideas about other types of things that can better account for why a person might be feeling some of these signs of depression. So medically related reasons. And so I just gave you a list of things that a doctor would want to rule out because it shares a lot of symptoms with other medical conditions. If you've got a pain that doesn't go away, you want to make sure that there's not some other type of disease process that's happening there, that there's not some problem with your sleep, your circadian rhythms are interrupted in some way, that you want to get those addressed or looked at. Medication side effects. Sometimes people can take medications and they can be what we call very activating. They can make you feel like you have too much energy, like you're almost on edge and a little bit anxious. And they can contribute to feeling tired. So you're wired but tired. If you've ever had too much coffee, you know exactly what I'm describing, that you feel wired but tired. You can have poor concentration because you're just too on edge and you're not doing well because of medication side effects. Diabetes and heart disease, they can also contribute to weight loss, to low energy, where you just feel like, ugh, it's too much effort to do anything. Parkinson's and Alzheimer's disease, early stages of that can make people very apathetic, where they have a hard time filling in the gaps in terms of their speaking, in terms of their thinking. And so they just don't do a lot because they're not quite sure how to be in the world. And they have learning problems and they've got some memory loss. And that could be also signs of depression, which is why we'll do a neuropsychological evaluation to do a differential diagnosis. Is it depression, or is it Parkinson's or Alzheimer's disease or some other type of cognate problem? Heart attack, sometimes people will say that prodromally, before a heart attack occurs, that people will feel depressed. They'll feel sort of on edge. They won't be up to snuff. And that can be a sign that they're going to have some sort of a vascular event. It might be post-stroke, it might be heart attack, but sometimes if they go back after the person suffered this type of an event, they'll get a better history and they'll find out, oh, I was really feeling kind of depressed. I wasn't feeling myself. And that seems to be sort of a consistent pattern with many people who do experience later on a heart attack or have some type of stroke. Psychiatric conditions, not surprisingly, anxiety, post-traumatic stress disorder, and then substance abuse disorders. People that are, drinking too much, that they can feel a sense of euphoria, disinhibition as the substances start to take hold. But then as they start to crash and come down from that substance-induced high, they can feel a sense of edge, a sense of depression, a sense of withdrawal that's very unpleasant. And that goes true for many types of prescription drugs. And you'll see physicians, they'll tell you oftentimes that if you're taking this medication, take it until the prescription runs out, or don't stop taking it all of a sudden. Let me taper it down gradually, because if you just stop at cold turkey, you're going to encounter difficulties. And that might be one of the problems. Depression might be one of the problems that's caused as a result of stopping to take your medications. So the healthcare system also plays a contributing role in terms of why things don't work out the way you'd optimally like them to do. We have racism, we have sexism, but we also have ageism. And ageism is something that a lot of us harbor, and many of us may not be really aware of it. And it's this belief that older adults require less care, less attention, and that it's really kind of normal to feel depressed. If I were old, I'd feel depressed too. I mean, who wouldn't if I were getting wrinkles and I weren't able to get around like I did when I was in my 20s? And so they minimize it. And in reality, that's the farthest thing from the truth. That's a huge myth that both lay people as well as medical professionals hold. And that's something that many times a family member or good friend has to advocate for their loved one to get the treatment that they need and would benefit from. We also know that few physicians are really trained adequately in mental health care. They're really looking at more of physical issues that are going on. They do their screens to look at respiratory issues, temperature, weight, heart rate, their pulse, they temperature. They look at all these different screens, and then they try to figure out like medically what's going on with you. And so it's really difficult to the 10 or 15 minutes that they're allotted for a typical visit for them to really be well versed in mental health care as well. So getting a referral can be really important. Many primary care facilities, if you've tried to get help, you'll find out really quickly they don't have any mental health services at all. They have no one to refer to. They don't have any psychiatrists. They don't have any psychologists on their team. And it's really difficult to find mental health services in a lot of medical settings. And then mental health insurance coverage sometimes can be very limited. So finding out like what types of services you can make arrangements for, maybe getting them at a reduced rate, but negotiating with providers just adds another level of complexity to trying to get care. So here are some false ideas that people hold that keep them from getting into treatment sooner than they should. And you may encounter some of these, either that you hold yourself, or that when you've been trying to help somebody, that this is what they've basically come back and said to you. That this idea that, if they just wait it out, the depression itself will go away. And we know that for people who have been feeling depressed for the past 2 weeks, and it's really starting to affect their functionality. They're not getting out, they're not doing things like they used to, they don't enjoy things anymore, they're not thinking about the future any longer, they're irritable or they're sad. These are all signs that the depression is not going away by itself, and that some extra help, some psychological treatment could make a big difference. There's some people who really believe that getting help is a sign of weakness. Now, this is what we call primarily a cohort effect, where my father's generation really felt strongly this way, that people, that if you had a good solid character, that you'd be able to like pull yourself up by the bootstraps and you'd be able to work your way out of it. And that there was something really kind of wrong, and it was sort of shameful actually to have some sort of mental health issue that you weren't able to deal with on your own. Some people feel like they're just too old to get help. Oh, I should let younger people get that, or that's for the young folks, or that doesn't apply to me. Other people may be concerned if they're older that if they're not in control of the situation, that they're not going to get the kind of services that they want. Many people are really afraid that they may have Alzheimer's dementia or some other dementing process. And there's this concern that if I ask for help because I'm feeling depressed, maybe someone will look at me and say, oh, maybe they should be in a nursing home. Maybe they can't be by themselves any longer and they need more care than they can give themselves because they're depressed. And so there's a sense too of telling your doctor that they really can't disclose it, that there's this uncomfortable feeling about sharing this type of intimate information about themselves, about a situation that they can't deal with. And especially if the physician's kind of sending signals that they've got 10 or 15 minutes and they're busy writing their chart, it may feel really difficult to advocate for oneself, which is why it's often advantageous, again, if a family member or a concerned friend can go along with on some of those appointments and really serve as an advocate to help describe better to the doctor what is going on. Some places where to seek help. Again, I've been talking a lot about a primary care doctor, and in many instances, they are the gatekeeper, that you need to go and see them first and get assistance. But don't forget talking to the nurses, that the nurses many times that, they're relaying information to the physician as well. And the nurse often can be a conduit and can really advocate for you as well in getting needed care. Psychologists, if you have the ability, we have the Gronowski Clinic at Palo Alto University. That's a good starting point in terms of making a referral and getting somebody within the community who can provide assistance. There's some community mental health centers that are located. Sometimes hospitals will have treatment teams, and they're able to send up a psychologist to do some sort of an evaluation and make a determination if that person might benefit from some mental health care. Senior centers, both community senior centers as well as senior centers that are housed in places of worship, for instance, many types of, especially larger institutions, mosques or churches, they may be able to, house different types of senior activities, talking to a rabbi and getting a referral. You'd be amazed at how many times different religious leaders have had some basic training in terms of being able to counsel their parishioners, but that when it becomes too complex or there's something going on, that then they too can make a referral to somebody who's in the community. When you're first meeting with somebody, it can feel a little intimidating. It feels like you've waited a long time to finally get this appointment, that you're there for them to make things better. And you may not be entirely clear about like what that entails and what are they going to do. And so these are a few very basic questions to kind of get the conversation started. Typically, a good psychologist is going to do what we call an informed consent process, where they're going to talk about what therapy entails and what they envision and share with you a little bit about how they function and what they can expect from you. And you might ask them if they regularly treat older adults with mental health problems, or they regularly treat older adults who are feeling depressed or feeling down in the dumps, or feel like they've kind of lost their zing with life and they need a little bit of extra help. You might want to ask them, how long is each therapy session? So sometimes there are people who might drive in from a good distance or take a bus, and it's the transportation part of it that can become complex. And so it may be advantageous to do a full hour session, where for other people, it may be better to do maybe a 20-minute session. And so, for example, if somebody's in an assisted living facility, it may be possible for a psychologist to come by and to stop in once or twice a week for 20 minutes and to check in with that person and to see how they're doing, because they can't tolerate a longer session. It's too much for them and too effortful for them to engage in that type of dialogue. And then you might want to ask their opinion if they should take medication in addition to talking therapy. And a lot of times you'll find that people will want to give you a medication if you see a physician, they'll say, well, let me give you a script for some sort of an antidepressant and take it for a while and see if you feel any better. But we know from our research that's been done that people who get the most benefit and improve in the most meaningful ways, they're typically the people who are taking both a medication as well as engaged in psychotherapy and working with a psychologist and really helping to find a way to better manage their symptoms, to find a better way to, recognize when they're starting to feel that spiral of depression and acting on that before they reach that point where they feel really dreadful. And so it's important to really get a better idea of how they function and what that might entail. But I do believe that in both instances, whether it's medical or working with a psychologist about the mental, you really want to be honest. And that can be one of the most challenging parts is trying to help that person communicate clearly their lived experience and what they're experiencing on a daily basis to that clinician. We know that people who are depressed sometimes have challenges thinking because it's effortful. And if you've ever been so sick where, you don't want to get out of bed, you don't want to, I'm talking about like a medical illness, like you've got flu or some kind of sickness, and you know that it's going to pass eventually, but for a day or two, you feel just dreadful and you don't want to talk to anybody because it just feels like too much work. This is what depression feels like psychologically. You don't necessarily have the physical symptoms associated with the flu, but it feels too effortful to talk. It feels too effortful to try to make your case to a psychologist or to a physician about why you need medical care and what your lived experience is. And so again, as a friend and as a family member, one of the nicest things you can do and one of the most supportive things you can do is to go with that person to the interview and to help make their case and to help them communicate and be honest about what's going on in their lives so they can start to get the treatment that they need. What will happen with a psychologist is typically they might give you a paper and pencil test to see if symptoms associated with depression are present. Now, this is something where you'll be asked yes, no questions, or maybe, like a little bit, a lot, or none at all. You might be asked on a continuum to endorse certain things and to fill that form out. And this isn't going to be used to make a diagnosis per se, but rather to give the person who has administered it to you an idea about your lived experience, about like the degree of it and what you're currently experiencing right now and what's most troublesome to you. It is like one of the first steps in kind of starting a dialogue where you can talk about your experience and find a way to start addressing some of your symptoms. There's no right or wrong answers. This is what you're experiencing. And a lot of people don't realize that there is no expectation that you're going to know all the medical terminology, that you'll come in and use all the right words that a trained clinician will use. But these forms will help in terms of really communicating clearly to the clinician, the psychologist, the types of symptoms that are most troublesome, and again, a starting point for what they might do in terms of treatment. Usually what they'll do is like ask you about what you've experienced during the past 7 days and trying to get an idea that this has been a long time thing or something that just has happened all of a sudden, but trying to get a sense of the duration and the intensity of the symptoms that you're experiencing. The good news is that depression is a treatable condition. Now, when you're depressed and you're in the midst of a depression, it may not feel like it's treatable. It may feel like you're in the bottom of a well and that there's no way that you're going to get out of it, because that's what depression does. It makes you feel very hopeless. It makes you feel that there's no way that you can be solved. And in reality, it is manageable, it is addressable, but you do need people to help you with that process, that healing process, and getting help from a trained psychologist is one of the first steps. We know that up to 80% of people with depression can be treated successfully with therapy. Now, am I saying that you're going to be cured? No, I'm not saying that you're going to be cured. We know that symptoms of depression, just like a cold or just like the flu, they can come back again. That part of learning how to live with your depression is to be able to do symptom management, where you become more aware of when you first start feeling this way and you're not feeling yourself, you have some strategies that you can use to kind of make yourself feel better in that moment. Antidepressants really work for a lot of people. Sometimes they work pretty well. Sometimes people need to do them in combination with other types of treatments. But generally speaking, it's worth considering doing both, using antidepressants and psychotherapy. And usually within 4 to 6 weeks, people start to feel better. And again, I think that being in treatment with a psychologist is helpful, because many times as people start to feel better, they may not always readily recognize that they're starting to feel better because they've been feeling bad for so long. It's difficult for them to really grasp the fact that, wow, today really was a better day than yesterday. And I think therapy can really help in terms of shining a light and help that person better understand their lived experience and how they're progressing. I talked earlier and showed you earlier that kind of road with the mood that goes up and down. Symptoms for depression can wax and wane. Some symptoms of your depression may be easier to address and more amenable to treatment than others. And so again, each person's going to be different. It's with treatment and with working with somebody who can come up with a treatment plan, very, very good first step in terms of starting that healing process. I have this picture up here because we know the saying, you can lead a horse to water, but you can't always make it drink. So what happens when you've got a loved one at home and they're not willing to get the kind of care that you think might benefit them after listening to the first part of my talk? Well, we know that change doesn't happen like flipping a light switch. There's stages of change. And so I'm going to describe those very briefly here. This is a model. There's a lot of different change models out there, but this is a model that is worthwhile thinking about. There's several steps to this. So pre-contemplation is not considering changing anytime soon. So someone's sitting at home and they're in a depressive state, they're not thinking about changing anytime soon. The idea of even trying to change is just way beyond what they could even consider at this point in time. Contemplation is where they're starting to consider that change might be possible. Preparation would be going to see the therapist and thinking about, really taking some of the steps that the therapist is just, providing to them in a treatment plan. And that action is really taking those steps and really putting them into play. And then maintaining a non-depressed state, that you work at that. That's something where you just don't, go through therapy and then, okay, I'm done with that, or I'm done taking my antidepressant. It's something, again, where you're really mindful and thoughtful about, how you felt in the first place and how you avoid relapse and going back into a depressive state. So these are the stages of change. Again, it's like sort of a gradual process. It waxes and wanes. It's not necessarily linear where you go through pre-contemplation to contemplation. You may jump around, but these are the stage changes so that you're aware of them, so that you are able to better deal with somebody that you're trying to assist with their depressed feelings. We know that a person will cycle, as I mentioned before, and that when you first offer therapy to somebody, they may not be at the right place where they're going to be open to it. They may say, no, I'm not going to do that. I don't feel well enough to do that. That doesn't sound appealing to me. I don't believe that's going to help me. So I'm not going to do that. But just remember that just raising awareness that they don't have to continue being in the state that they currently are in, and making them aware of some of their options they've got for treatment is a contribution toward their recovery. If you look at the stages of change, that you can see where you're creating awareness. And so you move them forward on that continuum. And it may be something that you need to invite them more than once in order to be able to get them into treatment. In the interim, you've got this person at home. They may be reluctant, or maybe they're in the pre-contemplation mode and they're thinking about going to therapy, but they haven't gone to therapy yet. And you're kind of thinking about, like, what am I going to do? What can I do as a concerned friend or as a loved one to help that person? We know that people stop doing rewarding activities for a whole slew of activities, a whole slew of reasons, and that these reasons are things that may not even be driven by depression, that sometimes I personally just get so busy that it's really hard to find time to build in pleasurable activities. When you start feeling depressed, you just don't feel like it anymore. And it feels like it's a lot of effort to get dressed and to go out to do these things. And so it doesn't feel like pleasurable. So why would I do that? And in reality, if you did do it, it would start to lift your mood. It would start to make you feel better. Just like that red line on that road again, it would start to bring that mood up with each pleasurable activity that you engage in. And so the more you are in that state where you're feeling sad or down or apathetic, the longer it is, in between, experiencing rewarding or meaningful activities. And so that mood just kind of stays low and flat. And so you want to bring that mood up. The problem is, there's always a problem, that focusing on changing feelings is really difficult, because they're difficult to change, because they're your feelings. That's how you feel. And so telling yourself not to feel a certain way, it doesn't do a whole lot of good. We all know that from our own experiences. But we also know that it's easier to change behaviors. And changing behaviors has the potential to eventually change feelings. So if you've ever had a workout where you've gone for a really good walk in the morning and you feel really good, it's been a really crisp day and it's beautiful outside, that the behavior of walking outdoors has left you with this feeling of feeling good, that you were outdoors and that it was really pleasurable. So that's really one simple example. So here, the rationale of, pouring sadness, but here you're going to want to start pouring pleasant events into somebody's, life. And these two jugs basically stand for a person's life. So anticipatory pleasure. So if a friend tells me, I'm going to take you out for your birthday, we're going to celebrate your birthday, I have what's called anticipatory pleasure. I pick out what I'm going to wear. I'm looking forward to them picking me up. I'm looking forward to spending time with them, having the meal. And so it's not just sitting down and having that moment, it's leading up to that moment where I have this anticipatory pleasure. People who are depressed feel anticipatory dread. Oh, I have to get dressed. I have to get ready to go. But sometimes you need to do what we call behavioral activation and get that person out of the house and get that person engaged in activities. And so, talking to a person who's depressed and saying, look, let's just pick one or two things that you might be willing to do with me. Would you be willing to go on a walk? Would you be willing to, work on a jigsaw puzzle? Would you be willing to, watch this show and then talk with me about what we just saw? And so finding a way to do an activity that would be agreeable, building in these pleasurable activities is one way to start improving a person's mood without having to get them to talk about their feelings. And ideally, what you'd want to do is not come up with a list of 20 different things, maybe like offer 6 or 7 different things and help that person pick things out, because asking a depressed person to generate their own list of things that they want to do, they're going to say, no, I don't want to do that. That's just too much work. I can't think about that right now. But instead, think about what would that person enjoy? What have they enjoyed in the past? What would they actually do? What's an achievable thing? And what can be accomplished fairly easily, so that I know that we went for a walk today. it's getting them out of this cycle, you know, where they feel exhausted, depressed, and drained, and then they feel immobilized, and they sit back on their chair and they feel guilty for not doing anything, and I'm just sitting here like a lump. And then there's no motivation for activities, and they get stuck in this cycle. And so it's pulling them out of this cycle. And if it means putting it on a calendar or saying, look, I really need for you to come with me right now, I need your company, then go ahead and do that. Get them to engage. But you also want to take care of yourself. It can be exhausting taking care of somebody or trying to cajole somebody to engage in pleasurable activities. So in taking care of yourself, you want to make sure that you are getting exercise, that you are eating a balanced diet, that you're getting plenty of rest, that you see your doctor regularly, because you don't want to get run down, because if you get run down, then you're both in a bad place. And you want to ask others for help. I know one thing for sure, after working as long as I have as a clinical psychologist, that it's really hard to read other people's minds. And it can be difficult asking people for help. People have concerns again about giving out private information or appearing weak, or they can't manage it. But asking for help is actually a sign of courage. It's actually a sign that you're taking the first step in terms of trying to get better. You want to stay active, talk over your problems with others. Sometimes I don't have all the answers, and by consulting with others, people have really good ideas that just haven't occurred to me, and it's really helpful. And problem solving. What's the problem? What are some brainstorming solutions? They may have some ideas for pleasurable activities. Well, you know, they really like doing this. You might want to consider doing that with them. And then trying them out. You know, look at this as sort of an experiment, that if one thing doesn't work, you go on and you try something else. It's not like that, you know, if it doesn't work, that's the end of the road. You keep trying things until something does click. So consider what's important. Consider, what would I tell a friend? If a friend was feeling in the dumps, what would I tell a friend to try to get them out of it? Keep your sense of humor. Try to have some faith in terms of things getting better. It can feel really difficult and really challenging. And again, when you feel that you're starting to run low on these areas, talk to other people. Social support is so important, that if you start getting cut off from other people and you're not connecting, it can be really a problem. So I'm hoping that I've given you a few ideas today to consider. I really want to thank you for your time in attending this. And I'm very appreciative that you came to listen to my talk tonight. And I hope it was helpful. And I hope that you're able to download the tip sheets and to get a little bit of additional information. So thank you.